guys to season 2, Hot Seat with Benzola, our very first episode. Today I'm talking to Udimpo and Ntamulo, and we are talking about the hot topic in 2020, which is COVID-19, otherwise known as the coronavirus. This is obviously a global pandemic, but I think I want to bring the discussion, very close to, the South African context in terms of how it's affecting us, because we are different. I mean, we're different countries, and therefore we have to deal with it differently. And I think we felt the need on the hot seat to also be part of this journey and discuss this topic in terms of how it affects us as a society, and what are the sort of things that we've had to adjust to. But without wasting any time, I'm going to definitely move on to you guys. Welcome to the hot seat, Dimpo. Thank you so much for joining us, and Tamulo. I really appreciate the time that you guys have taken to spend time with me today. I think it's a very important subject. I know everyone's talking about it. You turn on the news, it's COVID. It's and I think someone like me, I kind of feel like I've had enough. I feel like I've heard enough as well, and I really don't want to talk about it. But I think there's far more things that we can talk about to bring it home and just make us understand. So you are a health worker, Ntamulo, and I think that is why I wanted to have a chat with somebody that's that's helping the country fight this pandemic. If you can talk to us about how has this changed your professional life, and what are the adjustments that you've had to do? I mean, your business model and the way that the daily routine has obviously changed since this has come through. So talk to me about that.
Okay. Well, thank you for having me.
Yeah.
I had to rush from work to be on.
Yeah, of course, and thank you so much for that.
Right.
Yeah.
So to put things in perspective, right? I'll take you guys down memory lane.
Yeah.
I remember when I was a student in medical school at the UCT. This was back then in the early 2000s. Revealing my age.
Yeah, let's not reveal it.
But I remember one of our lecturers, he mentioned to us the progress that they went through when gloves were introduced, actually. Gloves. Back then, doctors didn't use gloves.
Okay.
There was no gloves. Just wash your hands and put some soap there, and life goes on.
Yeah.
So gloves were introduced because they realized that by introducing gloves, you can limit the amount of bacteria that moves. Yes,
absolutely makes sense. Yeah.
And then before then, obviously there was hand washing. I mean, that's another story. Hand washing was a big taboo back then. And then hand washing became the norm. Gloves were introduced.
And then those became the norm.
And then another glove was introduced. It's called the condom.
Yeah, of course.
So now, you've seen, now we have to wear another glove on our face.
Which is a mask. So we're a world of gloves, basically.
So
yeah.
So if you think about the human population or the human race, for example, we've had to adjust to the needs of the time,
Correct. Yes.
So in a way, it's either you adapt or you become extinct,
Yeah.
So in terms of what has changed, I mean, obviously the first one is the gloves, but even the whole entire lifestyle of a human being has to match with the times. So for example, in any sort of like interaction, for now we'll have hugged, kissed, and shaken hands.
But we didn't,
We didn't. So
we did a whole show.
So there's a lot of things that have changed. Even, for example, with my work, you will have couples consulting, cousins consulting, friends consulting. Now it's 1% the consultation. Even when someone comes to consult, by the waiting area, they get screened at the door. Whoever is escorting them, if they are strong enough, must go and wait outside. So can you see all of those where when you're sick, you want to be supported as much as possible, but now you can't because of we're trying to limit the context and stuff. So I'm sure you can add a bit more of
I was about to say, Dimpo, would you like to add? I mean, especially around the procedure and the process within the practice,
how things work.
How things work, and you've now had to add stuff. and to make sure that you one, are compliant to what the government says, and two, you're protecting your patients.
Like you said now, it actually does go beyond being compliant.
Yes.
Because if you're not compliant, then you're not protecting yourself.
Of course.
So the things such as entry point, having to check a person's temperature, reception area, all areas have screens now. You know, the doctors don't speak directly with the patient. There's a screen in between that's protecting both the doctor and the patient. The waiting areas, the spaces in between. Now, if let's say there's 10 people that need to be helped at a time, they can't all be in the same space.
Yes.
So that had to change. I mean, the same way we are changing our lives and at home. At home as well.
Yeah, absolutely.
I mean, when he gets home. Same as me. If I go to the shop, you have to undress, you have to go shower and everything before you see the kids. And that has been, I think, how it is from work all the way into...
So, I mean, I was actually about to ask to say, you know, as a health worker, you know, trying to fight this pandemic, you know, there's a whole lot more pressure on the health industry as a whole, and that must affect you, you know, somehow as a person, you know, and there are measures that you need to kind of make sure that you protect your family as well, you know. How well have you adjusted while helping others, but you're trying to help yourself as well, and you know, and stay safe basically in the personal capacity?
You see, there's multiple levels of personal capacity, right? There's the individual, obviously, and then there's the interpersonal. Like, for example, she's my wife, but if she goes out and she comes back, she must start from scratch.
Correct.
And imagine now with things like funerals and all of those things. So there's a lot of small areas where, on the personal level, it's affecting you to a point where you can't even try to conceptualize it, you know. I'll try to stay away from big words. Please don't. Let's speak simple English. So on the individual, before what government is doing or what the healthcare worker is doing, you need to understand the meaning of lifestyle changes, right? Like we've already mentioned with the gloves and all those protections, but it's more about the hygiene concept more than anything else.
So before you go there, actually, I've got a perfect question because I see you are going there. I want to know from you the what you're seeing with the general public, with your patients. You know, what are the challenges? What are you seeing that we still need to work on? You know, in understanding this pandemic and doing the right thing to protect ourselves.
The challenge with what can we do is there's a lot of, one, who didn't know how the virus behaves, you know, and then two, people don't quite understand how the virus behaves as well. So you get a lot of people don't quite understand what they are being taught, but there's a lot of hysteria, you know, you get corona, you die. And, well, it is true to a degree, 1% degree that we've observed. But on the bigger scheme of things, if the guidelines that are being communicated through multiple channels, I mean, government has actually excelled from my personal experience on what they've done. But now, same thing, when they had the lockdown on, who was revolting, you know? It was us.
It's the same community.
Yes, we are being...
So we are our own enemy, right?
Yeah,
so we want to be safe, but we actually don't follow the rules. And so how do we then fight this pandemic if we are the ones that are not following the rules?
So it's an issue in terms of us as individuals, like taking accountability. You know, everyone is sitting around, the government is not doing this, the government is doing that, the government...
What are you doing?
What are you doing? You know, you walk around right now, people are not wearing a mask. You see people, I mean, it's not an affordability issue in terms of sanitizer. There is water, I mean, almost everywhere. You know, wash your hands. People are not doing that. The trust issue where she's my friend and therefore I can sit and I can trust you and I'm not going to wear my mask. That is the issue right now.
So the friendship has nothing to do with the virus. The virus is there.
Because we don't know where you've been. You know, I mean, I went to a funeral last week with my sister and we were 2 meters apart and people were like, but it's your sister. I'm like, I don't know where she's been. And those are some of the issues that people are not taking accountability, and it has to start with me.
Talk to me about that, Dimpo. I think you're touching on a very interesting subject, because the norm we as a society, we've always had to change our norm, right? So funerals, I mean, I know that our funerals are like big, there's after tears, you know, there's, and we almost associate a big funeral to how great the person was. So if there were less people at a funeral, it's like, whoo, yeah, but you know, it's like, oh, it was a beautiful funeral because so we've had to adjust to the 50 number regulation. And how do you see that happen? Like, how do you see that happening? The whole funeral thing, because I've certainly seen a few funerals that were not, I can assure you that there were more than 50 people. How is that, how does that play?
Can I jump in there?
Yeah, sure.
I'm going to be
I'll still come back to you though.
I'm going to be a bit controversial on this one. My view on this one, right? Obviously, I beg to be corrected.
No, for sure.
The only funeral that you should be attending is either yourself's one, your father's one, your wife's one, or your kids' one. Even your siblings, direct siblings. Anyone else, distant cousin, neighbor, colleagues, yes, we need that in the whole spirit of Ubuntu to support each other. But the thing is, with our current setup, it does not make sense to go into a landmine, basically. I'll call it a landmine, because from evidence, it's been proven that when there's a lot of people, there's a lot of laxity with regards to...
the virus loves that idea of people, a lot of people.
Exactly.
It thrives in that environment, yes.
So it's a social disease, and it's attacking us at our weekends, you know, because our strength as human beings is being socially connected. But now,
because we thrive, I think we want that connection, we want the support. We are about kumbaya. This virus doesn't want kumbaya.
No, it doesn't want that.
And Dimpo, your opinion on that?
Well, I agree. I mean, he's actually giving like a suggestion or an advice of how we should
deal with it moving forward.
So if you look at it, like you've said, in an African culture, we will have people come in from Monday all the way down to Saturday for the funeral.
And a deep bright pack.
You have to cook it, you know. And it is our way, but it's very sad that people still stick to that without realizing the danger in it. You know, I remember talking to one of my friends last week, and they're like, but we have to go. And I'm like, the only challenge is you go, and chances are you'll be next. You know, if
it's not you,
it's somebody in your family. And no matter how much you think you have protected yourself, it's an invisible enemy. You know, so you can wait.
There was some also. I don't know if it's a myth. You can tell us around this airborne. You know that it's somewhere. It's in the air. It's everywhere, and that's how scary it is.
But in a group or in a gathering, there's more people breathing. So either way, whether it's in the air, it's on the ground, it's there.
People are breathing, right?
Yes, exactly.
So and those particles go up in the air.
Go up in the air. So and if you are, I mean, for example, if you're in a taxi, there's 15 of you, not 50. But because it's in the air, if they say it's in the air, wherever it is, I mean, we've got the mask on. If you wash your hands and you follow all the other instructions, it shouldn't matter where it is. Because
it shouldn't matter where it is.
It doesn't fly beyond 2 meters. You see the taxi, it's not 2 meters. You know?
So, I doubt there's compliance there, but
And also, I mean, like you're saying, something that I've seen, I mean, the issue, you asked about the issue, is that people forget that when you're wearing a mask, you'll find a person taking off the mask and then putting back on the mask. You're forgetting that the reason you're wearing a mask is to protect yourself from things coming to you. So where are these things? They are stuck on your mask. So if you just taking it off and putting it back on without washing your hands, without sanitizing, you thinking, but I was wearing the mask. That's what people are saying. But I was wearing the mask. Nobody touched it. But how many other breaths were in the room? How many other coughs were in the room that have been sitting on this mask? And that's also like a big challenge. Like funerals per se, 50 is not the big problem. It's people not understanding how to carry themselves.
So you can be 50, but if you are close together, then it defeats the purpose. So if you are 50, then you've got a social distance. And
if you're following the 1.5, you're putting on your mask properly, you're sanitizing.
But how do you determine 1.5, Jay? Just as a person, an ordinary person? That's
You take a
not-
step.
It's a step.
It's a step.
Yeah, if you understand that. So with the Da Vinci Code, I'll teach you. With the Da Vinci Code, normally a person from your shoulder here to the tip of your middle finger, that's a meter.
Okay, yeah,
Right? If you take a step wide enough with your legs, that's supposed to be a meter.
happy.
That's
I think
it.
that probably that makes sense to me.
Yeah.
I just needed us
So to be safe,
clarify.
have 2 steps.
Yeah.
And then you know that you have a nice distance away from.
Because guys, it's real. I find that there's we some of us are privileged to understand
Yeah.
pamphlets, to understand emails from the government, to understand in the English language, and
Yeah.
sometimes we take advantage of the fact that people understand the difference between quarantine and isolation, and you find that there's a real issue around understanding that, and I think it's important for us to drill down
Into that.
into that and explain. But before we do, actually, I want to get your opinion, Nhlamulo, on people are focusing more on the fact that death rates are less than recovery. So yeah, we are going, we are great. We're dealing with this pandemic.
Yeah.
But I just want to get your opinion on the fact that people are focusing more on the death rates being lower than the recovery rates, and seeing that as a success story. And I just want to pick your brain on that, to say, what are your thoughts around that, and what's the ripple effect? And in comparison to globally in the different countries, and how we're dealing with this.
Actually, that's a very interesting question.
Yeah.
I can give it to you in one sentence, right? Until you know someone personally who has died from COVID, 1% is something to celebrate.
Yeah.
But when you meet that 1%, who is either a cousin, a relative, an aunt, a mom, a partner, it's 1%. Doesn't matter the percentage, whether it's 1 in a million, whatever. It's 1% that you had the personal attachment to.
That actually has.
That has died.
That has died.
Yeah,
from
so,
this,
in statistical terms, it's great. It's 1%. But it's 1% of people that shouldn't be dying in the first place. Because if you look at the same time last year, I haven't looked at the maths or the stats, but the thing is that there were lesser people dying from flu-related or respiratory-related illnesses. So now you put in a catalyst like a COVID, and you have people dying from illnesses that should not necessarily be that complicated. For example, you look at diabetics, for example. If we were to do the stats of people that are diabetic that actually do not make it from the COVID disease, you find that it's not 1%, it's much, much higher.
Much higher.
Yeah, so the figures...
The figures
take them with a lot of salt.
with a pinch of salt,
With
right?
pepper and linganga as well in there.
I also put some cayenne pepper there as well.
You can take it with anything. But then, to conclude the answer,
Yeah.
you see, there's a lot of politics with regards to even the numbers of the people that are diagnosed, even the release of the results and stuff. So now when we arrive at, let's say we're getting so many people being infected per day, and we celebrate the small numbers that are busy dying, you know that accessing those tests within most of our, suburbs and stuff like that, or even in the townships, is not as simple as going to buy bread. Let me give you an example. We've had a lot of patients that we have seen in the practice, and we refer them out to go and do the test. If you look at the whole of Soweto, you can count the number of private institutions that are actually doing those tests. There's 2 that are from the same group, and then there's another one which is one of the bigger groups in the deeper south. I'll try not to name names because obviously we're trying to avoid that. But in totality, there's about 4 big hospitals in the whole entire Soweto.
So that actually speaks to privilege.
Yeah.
It speaks to privilege of having access. Even goes further than the privilege of isolation.
Yeah.
If there's 10 of you living in the same house and there's 1 toilet, how do you isolate?
You can't.
So can you see, you are starting to understand the depth of this problem. So the social determinants of health are actually the biggest influencer of how many people do die, how many can actually self-isolate. I mean, like you said, you're living in a squatter camp in
There's 10
Alex
of you.
or
Like,
whatever. There's 10 of you. You
There's
know?
10 of you.
I want my 2 meters. The whole place is 2 meters.
If one of us is positive,
Yeah.
sure, you can isolate maybe to that corner.
Yeah.
But the fact that you're going to use the same toilet,
Yeah.
the toilet is communal, so it's not full isolation.
Yeah.
But anyway, with that in mind, let's clarify the isolation and quarantine, please, guys. Can we just clarify the meaning of that and understand what that means?
Okay.
You know?
Should I do it?
Yeah.
Yes, of course.
Big English words. So, if you've gone for testing and you are waiting for your results, they say you and the rest of the people that you live with must be in quarantine. So you are not yet isolating.
Okay.
Once you test positive, and let's say there's 3 of us, we live in the same house, and you test positive, now you're isolated. Isolated means being completely removed from everybody else.
Okay.
You are alone. ISO means one.
Yeah.
So you are
So I'm
completely
in my room,
yes,
I'm
alone with no one
with
else.
no one there. So I'm not
Yes.
sharing the lounge with you guys or the kitchen or
No
whatever.
utensils. Like you shouldn't be sharing anything, especially if everybody else tested negative. In the
Okay.
house. So, but then the people you live with must be in quarantine.
Right.
Yes.
So they're in quarantine and I'm in isolation.
Isolation. Yes.
Sure.
And also,
Yeah.
there's one angle to that as well. So the people that are asymptomatic
Yeah.
do not necessarily need to test because there's no symptoms yet, so there's nothing to test for. So you've tested, you are positive,
Yeah.
you are in isolation.
Yes.
The rest of us
Are
are suspects, basically. We're not
Yes.
charged
So
yet.
we're in quarantine, but we don't have
We
symptoms.
are awaiting
Yeah.
trial.
Yeah,
Yeah.
we're waiting trial.
Yeah.
Okay,
Waiting trial,
sure.
yeah.
And if we go testing together, me and you, we live together, you come back positive and I'm negative, that doesn't rule me out.
Yeah.
That's why the government is saying people must wait till they are symptomatic. Even if, people saying, no, it's because there's lack of tests and whatever. But you can come back negative today because the virus hasn't brewed.
And then tomorrow, next
2
week,
days later,
when I
you
go,
start
I'm
coughing.
positive.
And then you say, it's just a cough because...
So it's are you then saying that it's best to wait and see
yes.
until you have symptoms?
Yes.
Because there's actually something to work with.
Yes.
I actually have a very interesting scenario for that, right? Let's say you stay in Jablan in Soweto. We know how safe it is in that area. And then they give you a gun with 1 bullet.
Yeah.
And then they tell you, walk from here to Bara, for example. And you've got 1 bullet. You can use it for self-defense. So if you leave your house, before you even get anywhere, like, I'm going to use this bullet, and bah, then they know you've got a gun, eh? Theoretically, it should be safe for you to walk to Bara. No one will approach you, but that's not the reality. The other scenario is if we give you that gun with 1 bullet and they say, use it as you please, go all the way to Bara. You think, okay, I can use this bullet whenever something scary approaches me. Right? And if something scary approaches you,
Then
you shoot them, and then hopefully you get to Bara.
Then you protect yourself.
So to make it to put it into perspective, you get a lot of people running around with hysteria, running for tests and stuff like that. That's your bullet at home before you leave. You've used
that
it,
money.
So now,
And it is quite an expensive test, am I
it's
correct?
about close to 1,000 rands.
No,
you know?
that's a
Yeah.
lot
So
of money.
Yeah.
when you do eventually get symptoms later on, what do? You now go and buy another bullet?
No, you probably can't afford another.
Exactly,
That's the
exactly.
thing.
So that's the simplest
That's actually an
way
interesting
of looking at it.
analogy, if I may call it that way.
Not that I'm promoting guns, I'm just saying in principle.
I wouldn't allow you to promote guns on
It
the hot
could be,
seat.
it could be even a catapult, with 1 stone before you...
Cool.
Right.
So let's talk about how this is affecting us socially. We are a country that loves to drink.
Yeah.
We're a country that loves to party.
Yeah.
We smoke, we celebrate, we do all sorts of things.
Yeah.
COVID comes. And, 1 minute alcohol is banned and it comes back. And, cigarette has been banned for a while now. Let's talk about that. And I want to address that to you, Dimpo. How do you see this playing out in our society? The banning of alcohol, the banning of cigarettes. Do you think that it plays a role? Do you think that taking care of some prevention, to this pandemic?
I'll answer that, but I want to start talking about, I think COVID has exposed other pandemics that we have as a nation. For me, looking at how people are fighting for alcohol amidst this mess that we are in, it's become such a priority that, the government is closing the alcohol stores and whatever, and we need to drink. It's become...
queuing from 7 in the morning with alcohol.
People have prioritized it even beyond COVID itself. You hear a person saying, hey, I'm scared of COVID, I don't want to talk, and yet you can actually wait on the line to buy the alcohol. It's not an essential. For me, I think it's not an essential. Just coming to the big problem that we have. We hide behind social, that we're socializing, it's how we socialize and with the drinks. But
we are reliant on it.
We are reliant on this.
Yeah.
And it's such a big issue. I spoke to one of my guys were coming to fix the TV, and it's like, but why should we suffer? Why should the president close for all of us? I mean, I'm a responsible drinker.
But how does the president know you're a responsible drinker?
Remember, also, the president is not making a decision for Penny that is responsible.
Yes.
The president is not making a decision for me that is not responsible. It has to be a decision that actually covers everyone else. And this is a life and death situation.
It is.
As us people that want our drinks or whatever, I don't drink, but people that want our drinks.
I want my drink. I do.
If we can understand that it's like I said when we started.
Yeah.
It's more than you. It's more than me. It's more than you.
It is.
If we start taking accountability, if I take accountability for you. Then we can win this. It's not about I'm responsible and I can have my drink at home without driving out. But we have to remember that alcohol is, when we said a coping mechanism, the reason you need alcohol, why? Why do you need alcohol? What do you want to do with your alcohol? I don't want to get deep into that.
Yeah, absolutely.
But then once you get that alcohol, like you're saying, you need the alcohol to calm down. Right? It makes you calm. Some people, it does the opposite, which is the reason why they're blocking it. It has nothing to do with blocking your social fun. Or I remember myself. I'm going to put myself in the spot. A couple of years ago, it was fun. Got this nice fun car. After having a few drinks, we remembered how fast this car is. We went, both of us. I was driving the M3.
You knew what the potential of the car is.
I was driving an M3. He was driving an Audi. We hit the highway. Nicely. It was after 10, 11 o'clock, and we hit the highway nicely.
We were driving 120 all the way there,
I believe you. It was 120.
Yeah, 120.
Yeah,
You probably even reduced your
But
and I think what you're saying, Dimpo, is so important, because I remember when alcohol was banned for the first time.
Yeah.
The stats were quite clear that the casualty stats were
it's
less.
Because
on the weekend there's people stabbing each other, people fighting and whatnot. So it does contribute to the way in which we behave. When we are under the influence. And the obviously the cigarette one, for me, I don't know what your opinion is, but for me it's quite simple. As a society that is not well off, where if we are smoking together, I light a cigarette and I smoke half and I give you. I mean, that's the virus transferring.
I think it goes deeper than that, though.
So I mean, I'm just talking it like at a high level without going into the detail. So if we all had money to buy a pack of cigarettes and without asking each other to smoke and share, probably it would be great. But
I would still block the cigarette.
I know, but what I'm saying is, in our social conditions. We don't all have the packs.
Before we continue, we're not done with the alcohol yet, So
it's cool.
If you think about the alcohol, it removes people's inhibitions, Even guys, I remember in varsity, you'll have friends that wouldn't approach a person that they like, whether they are male or female. I was in Cape Town, it was both sides, You find that after a few drinks, they're much more, it gives them the little bit confidence, so they're much more...
They grow balls.
And then the following day, how many of them will actually come back and say, hey, morning after pills or a condom broke? So people become more irresponsible.
They absolutely become irresponsible.
Exactly. You get that excitement and who's going to remember
social
your mask?
distancing is not a thing when you're intoxicated.
Yeah, exactly.
Right?
You want to tell a friend, hey, and then they are busy spitting up when they speak.
And they like to speak, and you're in a loud area, and they're speaking in your face.
In your face. So your personal care becomes a bit compromised. So you won't remember to wear the mask. You won't remember to sanitize. You won't remember to keep that distance.
You don't remember to go home and sleep there.
Then you're gonna go fight. It's like the people that have been exposing themselves.
Yes.
I mean, you come together and you're like, we're gonna have a get together. No one's gonna see. Next thing, when they're drunk, what do? They start taking videos of themselves.
Exactly.
They start posting on social media because they're not thinking. You know, and also, I mean, with when you started, you mentioned that hospitals fill up, which is, I think, the reason why the government is doing this even now. Is because of these liquid confidence that we're talking about. People start fighting, they start stabbing each other. That is overloading the hospitals. Unfortunately, as South Africa, we can't look at the United States and look at Italy and look at all the other developed countries and compare ourselves. Our health system is broken already before COVID.
It is.
It's very broken. I mean,
it's not even broken, Dimpo. It's strained. It's there's heavy weight on it.
Before COVID.
You know, there's so many people on the public health system that they're not coping, and I think COVID has just made it worse.
That's why I'm saying COVID is showing the problems that we are
showing
having.
the loopholes.
So if we can start dealing with some of those, like with the alcohol ban, already now, if you look, there's already a lighter load.
No, there's a decrease.
we haven't received SMSs of divert since they've
there's a decrease in police stations. People arresting domestic violence. Because some of the domestic violence is caused by that. So I totally get that, and I think as a society we are struggling to deal with the ban, though. We're struggling to understand because we all think we can control it.
Okay.
All right. The cigarette part as well. I mean, if you think about it, it causes compromise of your lungs.
Of the lungs, yes.
And
outside of just sharing a cigarette, but smoking
Yeah.
itself, and this disease is a lung disease, am I correct?
Exactly, that's what I was trying to get to. That. If it's a lung disease and then
you are busy
puffing and passing. But even within that, I mean, you get people that use it as a coping mechanism, you know. So what she was saying is that there's a lot of pandemics that are within our society that we don't see. I mean, alcohol has been socialized in a way. It's acceptable to be drunk and disorderly. I mean, remember when they started banning cigarettes in public spaces, restaurants, and all of those things? That was a big hoo-ha so many years ago.
But now I think the world has moved on from that. You understand? You don't smoke in a restaurant, and it's actually become not cool because you people that smoke now have to suffer. Like you almost have to go outside even when it's cool. It's like it's not cool anymore. Before it was. So the restaurants even brought you the ashtray. The waiters had a lighter, to light for you. So it was a thing. I see what you mean. In fact, I wanted to move to the issue of stigma, with this COVID. And I'm in the corporate environment. And as corporate, we obviously try and track these with employees and stuff. And I find that people are not comfortable to say that they've tested positive. It almost takes me back to where we were with HIV, because it had a stigma. One of my previous guests actually sent me a message, letting me know that she's tested positive for COVID, and I want to play that for you guys so that let's listen to what she's saying.
My name is Michelle Mabaso. I tested positive for coronavirus. And I'm currently in quarantine. As you can see, I'm in my room where I'm quarantined. It's been an emotional journey. However, I try by all means to keep my mind positive about it. Looking forward to getting better. Looking forward to getting through the 14 days of quarantine. I eat healthy. I drink a lot of vitamins. like these vitamins, your Berocas. I went and got myself your vitamin B complex, your multivitamins, these ones, your vitamin N as well. I steam twice a day, in the morning and in the evening. It helps unblock when I'm blocked. And to unblock my nose, I steam with what they call umhlonyana. It's a traditional plant that is very helpful. Or if I'm not using that, I also use Vicks. So steaming has helped. I also go and sit in the sun for like 30 minutes to get sunshine D, and it makes me feel fine. So I am not lonely. I have not taken sick leave from work. I work still. And I'm in the room with my laptop and everything. I run a team at work, so I speak to my team, I speak to my guys. I get phone calls from my family, from my friends, from my team. So I have the support from my doctor as well. They check up on me quite often. So I'm fine and I'm getting better. I'm getting there. And I know I'm going to knock this out. I know I'm going to win this. Thank you.
Well, the first part, which we need to, is obviously thank you for sharing such information. Like you've mentioned with the stigma, there's a lot of misunderstanding, hysteria, excitement, all of those things. So that's one of the parts. It takes a lot of bravery, and I mentioned maturity earlier, but then to put that more into context, you get a lot of people, even that are in the medical field, when the results come out, the brain switches off. And then they start running, doing all.
So they start behaving like humans.
Yes, yeah.
Well, they are human, guys.
Yes. Well, they are human, but the thing is,
they conform to the narrative.
Yeah, exactly.
Yeah.
So there's certain levels of being human. For example, you are human in your personal capacity.
Correct.
You are human in your professional capacity, and in your cultural capacity, religious capacity. So there's a lot of capacities depending on your perspective, right?
For sure.
But if us as the medical field abandon all our knowledge and all the research and the advice that has been shared freely and widely so, when the moment of truth comes, then can you see, imagine a person that has got no way of verifying.
So we're really expecting too much from our ordinary South Africans in this regard, because this is a tough one.
Yeah.
It's a tough one.
I always say allow yourself a time of shock. It's allowed. I call it a time of shock, and I've said this to him because sometimes he's like, these patients, I'm like, no, allow it. It's a time of shock. At that moment, your mind switches off and it's like, you're dying.
You forget.
Everything else. You forget that you've been drinking your mkhonyane and your colleague and your whatever, and it's like, oh my God, now I'm dying.
Yeah.
And it's normal for that. But I want him to comment on some of the treatments that she's taking.
I'm also interested in.
Yeah, there's some things that worry me a bit.
The Mhlonyana, the what.
Before he goes there, so there's some things that worried me, because there's a certain thing that everyone, I remember I shared this with my friends, my friends always come to me because of him, that Tims, I'm drinking this and this and this and this and this, and my response, they always say, you're going to come with your educated response to say, don't go with what everyone is doing. I'm here, I'm not taking any of those things. I take my vitamins every day, and that's it. I'm not taking mhlonyane. I'm not taking zinc.
Mhlonyana, can we just unpack that for our viewers that don't understand what mhlonyana is?
So in my language, kilingana. It's a herb, right? It's a herb. It's now I grew up drinking it. When we had flu, my gran would boil it. Yeah, it's like alvein, mahalakan.
I remember my great-grandmother used to do.
So but now I don't know if it's the same with mhlonyane, because I've seen images where it's mixed with other brown stuff, but for me it's a greeny grey color, and I know it because we have it at home.
You were mainly taking it for flu, right?
For flu.
Okay.
So here's my thing, and this is not even from a medical perspective, but it's from a common sense perspective. Why would you take anything when there's nothing wrong? You can't prevent by taking Panado. If I take a Panado, I'm not going to get a headache. That's not how it works. You know?
But she's already got COVID.
No, I'm not talking
Oh, you're
about
not talking
her.
about.
I'm thinking of.
you're
This is
talking
a line
about the
for the
other
mixtures
ones
that she's taking. There's so much mixtures that she's mentioned. There's so much mixtures. People are taking all of this. Why?
So Mina, okay, I haven't tested positive for COVID.
Yeah.
So are you saying that I shouldn't take Mhlonyana to
You can
protect
take your
myself?
immune boosters and you can take your vitamins. Why are you taking Mhlonyana? What
vitamin actually works? Is it because I'm seeing a lot of vitamin D and zinc?
So vitamin C is basically to prevent from flus. We take it even with flus, and COVID has presented itself like
as
a flu-like virus.
Okay, and then because I see she spends 30 minutes in the sun.
Yeah.
Do you need the vitamin D for this type of
with the
infection?
sun, it said that he'll tell me, but it said that COVID is scared of heat.
Oh, okay. So we're dealing with it.
Yeah, we're dealing with it like that, and like the sun is that's what it said. That's what I'm saying. He's gonna come from a medical perspective.
Yeah, no, we need you to come.
I've heard that it's because it's scared of heat. It's scared of. I mean, there's been a conception where people are saying the virus has a certain percentage. Or pH level. Yeah. It has a certain pH level. That's why you must drink lemon.
So if I go to Johnson and buy one, the face thing, in a pH level higher.
Yeah. You know, so it's a pH of 4.5. Therefore, lemon is no. So for me, it goes back to knowing what this virus is and what it does. We now know that it attacks the lungs. What I said to a friend of mine, I was like, take a skipping rope and let's see if you can last 5 minutes. As a preventative.
Yeah.
Let's see if you're going to last 5 minutes.
Then when it comes, you are ready.
That's it. People should focus on fitness. And I said, fitness, not, somebody said to me, but there's a guy who was strong, had muscles, and I finished him off. I'm like, we confuse fitness and strength. There's a difference. Fitness in terms of cardio and strength. That's why I do both. I run. And I do strength training. So running, it's for my heart, it's for my lungs. Then strength training is for toning, for we want to look nice and all of that. So people are saying, I'm going to drink Mhlonyana. You're drinking Mhlonyana, you're drinking your vitamin C, then you go and have your cake, right? Carbohydrates and sugar and your cigarettes. Yeah. Is Mhlonyana going to do miracles? Is it like a magician?
Yeah, I don't know.
No.
There's no relationship.
There isn't. And if we understand what this virus is and what it does, for a preventative, for a person, I would tell it, go run a kilometer, see how you survive today, tomorrow, and then see, rather than your Mhlonyanis and all of that, But then I want him to comment on some of the stuff that she's
I think it's important that from a health professional perspective, you comment on how does one deal best with COVID-19? And that's obviously not cast in stone.
Yeah.
It's, that is your experience in your work. You are in the health services and you do deal with these things every day of your life. So what would you say is the best? Because I also don't want to strain my liver with all these concoctions and stuff. Because it needs to flush out the stuff. So what's the simplest, best way to keep myself strong and immune so that when it does attack, I can fight? Because I can't say I can 100% protect myself from it. So, but all I can do is get ready for that. When it does attack, I'm strong enough to deal with it.
Okay. Yeah. So the best way to answer this is, the first one is get informed with the correct information. And then after that, you can get fit and everything. So by getting informed, she mentioned that she had diarrhea, she had back pains and stuff. And if you go to ShopRite today, not even ShopRite, any shop where there's an entrance with the proper controls, what's the first thing that they're going to do? They check your temperature, right? So they check your temperature and it's 36 and everyone celebrates. Then you get this false sense of security.
But you might actually have diarrhea.
You might actually have diarrhea.
Because your temperature is fine.
Yeah. So if you look at the whole list of symptoms, I haven't seen a lot of people with all of them at the same time. And then these symptoms,
so there's multiple
depending on the stage of the disease, because it's a multi-phase, multi-organ disease. You might come through it in stage 3, for example. I don't think they mentioned like stage 1 or stage 3, but you might come through like after about 3 days or 5 days. So depending on where you are on the progression of the illness, you present with different symptoms. For example, she started with headache and nose running and all of those things. That's when it normally starts. Stage 1, or phase 1. And then the next phase will be the lungs. And then the rest of the organs can follow. Funny enough, we've even had patients that have presented with a stroke because of COVID.
Wow.
Remember she mentioned that she's taking Disprin and stuff?
Yeah.
We'll get to that.
Clots,
Yes, we'll get to that in a bit. But because you are locked up, she mentioned locked up, because you are locked up, you are sitting there watching TV on your phone, sleep, wake up, and go to the toilet, and that's it. Your level of activity has decreased to a point where your blood flow from the leg back up becomes affected. And then you have a blood clot. Even at hospital, normally when you are admitted for a prolonged period, they will ask you to mobilize. So you must get out of the bed and move around.
I know they usually get like a, what do they call them?
A physiotherapist.
Physiotherapist that comes and walks you down, up and down.
Yes. So that's to prevent you from being too stationary to a point where your blood is like thinking, hey, we're also on lockdown.
Yeah.
Then it clots, and then you're in trouble. So the Disprin that she's taking, it's good, but I'll put a big caution around it. If you have ulcers or you have any risk for bleeding and you take Disprin,
then
you're gonna be visited by AFBOB. You'll be gone because the thing is you're gonna bleed and then it's a problem. So
Nhlamulo, are you saying that even in isolation, don't just sit on the bed and go to do some exercises, move around to help your blood flow.
Yeah.
And don't be that sad case that says because I assume it's very lonely. It can be very lonely sitting there isolated and not having, especially if it's in the same house and you can hear other people laughing in the next room. But you're insisting on the fact that you must still move around for your blood flow to continue. Okay.
So on a mental well-being space of view, point of view.
Either way,
that space. Remember you mentioned the stigma. So people don't necessarily freely share their experiences with other people because, COVID, it's going to be a problem. So
your middle name will be COVID.
Exactly. So you end up there in your dark corner in that room and you just don't want to talk to anyone because you don't want to tell them about COVID. The people that are in the house with you are obviously scared to come close to you because you've got COVID. So you end up being more and more lonely and you end up just sitting there. So if you think about it, going outside to get the vitamin D, it's to break the cycle. When you're sitting in a gloomy, dark place, you start now your mind going.
Yeah, it's also got a psychological
it's got a huge psychological effect. And remind me later on, I'm going to be very controversial on this one, I'll probably get into trouble, but anyway, no one knows what happens with COVID. You've heard that they've moved from 14 days to 10 days and all of that.
Yeah, let's talk about that, guys. Someone said, no, it's no longer 14 days.
It's 10 days,
Okay, wait, but what informed that decision? Has the virus shifted? Does it get better in 10 days now? Or what's going on there?
I would say it's research. Obviously, research shows that,
in 10 days you are fine. Yeah.
The reason why they're doing that is most of the times by the time you go for the test, you're not on day 1. You're actually on day 5, 6, maybe 7.
Oh, yeah. Because now you have symptoms, right?
Yes.
So it's not really day 1.
Exactly.
Yeah.
So your day 1 is very figurative.
Day 1 is not sure. We are not sure when your day 1 was.
So let's say hypothetically you get COVID today, right? And you start getting symptoms on Wednesday. You're already on day 4. So now when we test you and get the results then,
you get the test 2 days, 3 days later.
Yes, can you see that's already 10 days. So 4 plus 10 is 14.
Yeah.
But the biggest challenge there is, how do we know when this person got the virus? You can't tell.
You can't tell.
So now...
So we're dealing with a lot of unknowns here.
There's a lot of unknowns, and these blanket policies are not necessarily good for everyone. Because to come back to the psychological aspect of it, you just came from a near-death experience from what the general public is saying. Are you mentally fit to go back to work after the virus stops dealing with you? Or you need some recovery time? Can you see what I'm trying to get to here? That
I actually know some of the people that have been infected, and while in isolation they've had their laptops and because we've been working from home in any case since
That's
lockdown,
actually good.
They join MS Teams.
Yes.
They speak to their colleagues.
Yeah, that's good.
You know, they're going on about their lives, so they're working and stimulating. But you know, so the loneliness becomes a bit less.
Yes. Exactly.
Even though they can't interact with their children or their mother, but you know, from a work perspective, they still continue. And I find that's, you know, I mean, they certainly said that it does help.
Because remember, not everyone is sick. Yes, you are.
You are positive, but you're not
positive.
sick.
Yeah, you probably have diarrhea. You have to go run to the toilet 3 or 4 times a day.
Actually, the diarrhea will save you. You won't get the close to your legs yet.
You know. So you're probably dehydrated, but you're not sick.
You're not sick.
It's not like you're incapable of even making food for yourself. You are okay. You know, it's just that you can't be where there's people. The people that are working, I say kudos to them. You know, we've had to quarantine. I mean, from exposure. He was exposed, and we had to quarantine.
Yes,
I've explained what quarantine and isolate is. Yeah.
He's the most exposed person. And you know, how do you guys deal with that?
But there's a difference. Another confusion with what people think exposed is.
Yes, talk to me about that.
So if I tell you that I tested positive tomorrow, you are exposed.
Then I'm exposed. Okay.
But if I'm here, I'm wearing my mask, I'm a certain distance. Even if I test positive, you are not exposed because you have your mask. That's why they call it PPE. You have your full PPE.
I've protected myself.
Yes. Yeah. Then that's not really an exposure, but he'll correct me if I'm wrong. Right?
Okay, that's fine.
So people will be like, we were in the same room, like in this room together. You had your mask on, you didn't touch, you didn't do anything. Hey, I was exposed, and they ran to go test.
But before he clarifies that, I mean, have you guys had a scare where he was exposed, and how did you guys deal with that?
So it was still early on in like when we started, you asked us about what have we had to change. So the masks were there, but there was no screens, there was no proper systems. I don't know if I can put it like that. And a patient came in with a partner, which is why we've stopped people from consulting together. And the patient who was consulting was fine. Well, she thought she's the one that's sick and everything was fine. Whereas the partner is actually the problem. You know, and we didn't know that they're positive or anything like that, but they were coughing everywhere and there wasn't those screens. And
I mean, everyone took time to kind of get on and adjust to this new way of putting the screens up and whatever, because we didn't know what we were dealing with. And I think even when lockdown first started, we didn't know what was required, and these regulations kept changing and stuff. So and I assume there might have been a risk there. You know?
Also, the temperature was checked and it was normal, so I thought, I'm fine.
There's the temperature.
Say temperature.
Can tell me more?
So there and then. Well, he should be telling this because it's his story. I wasn't even there. But there and then, when there's a dry cough, where they call it the COVID dry cough, he realized that actually, you know. And then there and there on that day, we realized, okay, maybe we should keep away, you know. And we stayed home. It was hard for him because he can't go to work. I'm always working at home with the kids, but it was hard on the kids because that means labs can't go back to school. We had to salve and let the school know, and obviously the stigma when the school has rules that you have to declare that you are positive or not. So we had to declare that we are in quarantine. We went to test. The test.
And were you hugging your kids? You couldn't, loving them from far.
2 meters.
2 meters. Hello, I love you.
2 meters.
So that must have been hard. But it is what it is. That's part of being responsible, I guess.
But we remained working. And at that time we thought, okay, we're just being safe, and we remain working. That's why I'm saying people that test positive and declare but still continue working, it helps. Because I said to him, like they say it's a lung disease, I say it's a mental disease. Because not that it attacks your mind.
It's a multi-organ disease.
I mean,
I guess. I mean, it could affect your lungs in such a way that you can't breathe and you have to have an oxygen.
Yes, that's what it does to you.
But when the time comes where you are now stable, you are awake, you realize what position you're in, and you deal with it and you fight.
And also we need to put a big disclaimer on this concept. when we say continue working, we don't say wake up and go back to work.
We are saying
You
virtual
are at
working.
home,
Yes.
in your
Virtual,
self-isolation
in your
space.
laptop,
Yes.
MS Teams,
Yes.
or not even a laptop. If you are writing a book, then continue
Right.
doing your thing,
Yes.
but not physically going to work. I
Yeah.
mean, most of the companies have been working from home since March and they haven't
Yeah.
gone back in
Yeah.
any case.
Yeah.
Obviously, for those jobs that can be done without physically going
Being
into the
there.
office.
Yeah.
But yeah, I can only imagine how that helps you carry on if you
Yeah.
still have a meeting to go
Yeah.
to, if you still have a
'Cause
report to submit.
With everything, it starts in the mind. They always say that, philosophers and smart people, they say it starts with what you think, what you believe in. If you say, oh my God, I'm sick, oh my God, then the body
But
follows.
the mind is very powerful.
Everything follows.
Very, very powerful.
So if you keep your mind occupied and positive, and then the likelihood is that the body's going to also fight. You know, it's like if they say to you, I said to a friend of mine again, that think about when your boyfriend breaks your heart. Because you're hurt and your mind is thinking, what happens? Have you ever had a heartbreak?
Yeah.
It's like your whole world
Who
is
hasn't had a
falling
heartbreak?
apart. It's like your whole
Like your
world
whole world
is
is
falling apart.
Hey.
Do you have a virus? No.
No.
It's in your mind.
And today I'm the happiest person. That
Just-
breakup, I don't even remember it.
So imagine now, if your body is feeling like that because
Yeah.
of this breakup, you're heartbroken because of the COVID, and then now the virus is there. It's not like with a breakup where there's no virus, you just have to deal with your heart and you're fine.
And Tamola, talk to me about, I mean, if you've gotten feedback from some of your patients around the loneliness that goes with this, obviously isolation. I've had a few people, in fact, I saw an interview the other day of one of the nurses saying it's so lonely that obviously no one visits you when you're in hospital.
Mm-hmm.
And up until you die, sometimes, if you die, then your body doesn't even go, in the traditional norm
Yeah.
where the body goes home. In this case, it doesn't. It goes straight into, it's like it just feels so weird for us.
Yeah.
Because we are used to, our therapy is seeing the box the day before and opening
Yeah.
and seeing the face, somebody lying, because that's the last thing you see.
It's
And you
closure.
make peace and it's
Yeah.
closure. And I can only imagine how this is affecting the closure part and our ritual of and you see this person and now you find them at the graveyard and they don't open and so have you had any feedback maybe from some of your clients or your patients around the loneliness that comes with it in isolation?
So what we've done is we set up a WhatsApp support line basically for our patients.
Oh, wow.
So when a patient comes in, we listen to their symptoms, we check them, refer them to the lab for the test, and then we tell them, listen, don't come back for the results, and please don't call us as well, because the lab will send you an SMS, right? But that system is not
That
been.
SMS story.
Yeah, yes, it's been. It's been
That's a whole topic for another anyway.
So to solve the SMS story and the loneliness story, we've set up a support line, right? It's
Well,
a
well
WhatsApp.
done,
It's a WhatsApp only. Although
Yeah.
some people insist on calling that
No,
line.
no.
The reason why we have that line is so that patients don't become lonely and feel neglected.
Yeah, I mean, there's at least people you can chat to.
Yes.
Even when your body's failing you that day, you can say, guys, my body,
Yeah.
and then someone else will comment to say,
So how it works is we send you a list of symptoms and you have to report to us daily. So you must say yes, no to the symptoms that you
Wow.
have.
Wow.
So that allows for us to track from day one what has changed because they have to change. Things have to get better, not worse. So you start to see, and even though we don't call you, by you saying, and then there's somebody that will respond, noted, you're doing fine,
Yeah,
keep going.
keep
At least
going.
it
well done, guys. I think
Yeah.
that's like the best thing you can do. There is no other way to support the people because we've got to be virtual now. But
Yeah.
at least there's a platform to which and I've always found that communicating how you feel in writing does actually help, and because you're letting it out and you're releasing it.
And
So
also,
that's actually a great idea.
we also have advances in the regulation space where now virtual consultations with patients are actually legal now, So there's telemedicine, which has boomed, So most of our patients, especially the ones that are on isolation or even on quarantine, if things change, for example, you are on quarantine and you start now developing symptoms, to get you tested, you don't come to us. We email you the letter.
Yeah.
You go straight to the lab, you get the results, and then we email you the prescription. And some of these pharmacies can even deliver to you, or you can ask your support structures to get those.
So these are the kind of adjustments I was talking about earlier, to say, you know, these are things you've had to adjust to. These are, you know, you're adapting to, you're responding to the macro environment. You know, as a business, to say, I can't see you physically, but I can email you the prescription. I can send you straight to the lab, so that you continue dealing with this thing. That's obviously taken over the world. But yeah, I think that's awesome, guys. That's really, really awesome.
And then with regards to supporting families, we had a scenario, I think it was about a week ago, where one of our patients, the partner tested positive. He wasn't seen by us, and then he unfortunately passed away. And then during that period, they were through a separation situation. I don't know. There were entanglements within the relationship. You know?
Well, we're not gonna go there. But
Yes. Long story short, the family ordered her not to come to the funeral because they were divorced. The legalities of that are something else. And then I looked at it from a very, you know, it will say, people would probably say a selfish point of view, but from a practical point of view, they're actually saving her. If they don't want you to come to that funeral, yes, it will be painful emotionally, the sending away and all of those things, but you are away from a contact of 50 people that you wouldn't have interacted with in the first place.
Yeah, well, I guess it aligns with your opinion earlier on around, you know, if it's not immediate, don't attend it.
Don't attend. This was immediate, but she was being ordered by the other family.
And that's okay.
And you don't have the energy and the space to be going fighting people to be at the funeral.
Especially people that don't want you.
Yeah, exactly.
But it must be traumatic.
It is definitely traumatic. It is definitely traumatic. You know, so that's why I was saying it's a bit of a cynical way of looking at it, but if you have to take any positives from any of these bad situations that we're in, it's like celebrating the 1%. I mean, like, you know, there's a lot of ways of looking at life that we didn't have in the past, and now we are forced to adapt to those levels.
Absolutely. Yeah. Wow, thanks guys. Thank you so much for joining. This is like, I feel like we could go on forever, but like, guys, we can't go on forever. So, but certainly for me, it's such an insightful discussion to sit with, to have this conversation versus watching the news, reading an article, you know, everything you put on the TV, COVID. And I must say, I struggled to plan for this episode because I'm like, yo, COVID, I'm really tired. But I must say that you guys have clarified a lot of things for me personally, and I hope that there's a lot of things that have been clarified for you as a viewer as well, because there's so many things that are being talked about. There's so many information that we're exchanging. And we lose sight of what is real and what is not real. But for me, this virus has entrenched itself in our lives. And I don't see it. You know, a lot of people when lockdown started were talking about, I'm going to do this after COVID. There is no after COVID. You know, so push on. Whatever you've paused in your life to say, I'll do this after lockdown, it's not going to happen. You know, pick it up and move on and learn to live around with this virus. And that's why I was saying to you earlier on, I've gotten a lot of information from this discussion around how to protect myself so that when it comes, get ready. Let it come. When it comes, I'm ready. And I need to be strong, and not that I can't get it. I can't guarantee that because there's a lot of unknowns. There's so many, you know, I could get it anyway, and life has to go on with the virus, and education is probably what we need more, especially based on what both of you have said. These funerals that we insist on Ubuntu because we need to support each other. We almost have to be selfish and protect ourselves. You know, if people know you love them, whether you're there or not, they will accept. They should understand. You know, whilst the rules may say 50 people, it doesn't have to be 50 people.
It can be even less.
It can even be less people. You know? And I feel like as a society we're struggling to conform to this new way of life, to conform to the distance, because we thrive on togetherness, we thrive on connectedness, which is not a bad thing. But but we are now having to adjust our lives and love each other virtually,
Yeah.
which is quite a challenge, because if you look at the different LSMs that we've got in the country and the demographics, not many of us can afford the virtual life.
Yeah.
You know, data is a big thing in the virtual space. You know, and for me to call you and love you via WhatsApp call, I need to have data. If I don't have, then, you know, there's that distance. So, I don't know, guys. I can go on forever, but thank you so much for coming and joining me together.
One more thing before we
close.
close.
Yeah.
Before we close.
Yes.
Remember, we're talking about keeping the numbers low at the funeral.
Yeah.
If you put that into perspective, by saying don't go to the funeral, we're not saying don't support the person. So if, let's say now you have 5 friends and one can bring veggies and what, they can come and drop them and leave, you know. They mustn't come and mingle with everyone else or come and now want to greet
the
and
support
hide.
can
Yes,
still be
so the
arranged.
support, yes,
You
definitely.
know, there's drive-by baby showers these
Exactly.
days, there's drive-by what.
I have a
There's
friend-
deliveries. I mean,
Yeah.
in fact, a friend of mine lost her dad 2 weeks ago. I offered to buy, you know, I offered to buy biscuits, you know, and she said, no, we actually got a lot of biscuits, I must buy juice. And I ordered, you know, she specifically, I ordered online and it was delivered. I asked her for the address, it was delivered there.
Yeah.
You know, I felt that I supported her even though I couldn't be there.
Yeah. I think the best way to move forward is tell yourself that I am going to get it.
No,
Like,
sure.
I'm going to get it.
No, and I'm waiting
Like
for
people,
it. It must come.
just wait for it.
Wait for
prepare
it.
yourself.
Be prepared.
Block out the noise. I think we know everything we need to know about COVID. The only thing we're waiting for is cure, if there is, or
Yeah.
whatever. But in terms of what it does to your system,
But
what
now
you
we're
must
going
drink,
to deal with
we
it.
know.
Yeah.
Then forget about the concussions and everything that everyone is talking about. Have your doctor on speed dial. I'm not doing marketing, but have your doctor on speed dial.
But what
because
about those that actually can't afford to have a doctor on speed dial, that go to public services?
then go find out what underlying conditions you have now before you have it. That's why I'm saying go to your doctor.
Okay.
So if you have diabetes, if you have whatever,
So understand
find out
your health status.
now
That's what you're
before
saying.
COVID,
Okay.
because then that will help you know how to deal with it. Like if a person has an issue of pulmonary embolisms, you can't have Disprin. That's going to kill you, definitely. It's not COVID, it's Disprin that's going to kill you. So understand, moving forward now, accept that you're going to get it one way or another.
But also spend more time with yourself and your health,
Yes.
and
Find
understanding
out what you have now.
conditions you
Go
have.
test, go to a
Because
public
that's going to
hospital.
guide how you move on.
forward.
And
And that's
you
it.
can do a trial run. Have a day, phone off, you in your place there, and don't interact with anyone and see how you feel the following day.
Yeah.
If you feel like you could kill someone the following day, hey, you're not ready for those 14 days of isolation.
I think that's a good one. Guys. Let's do a trial run.
Yeah.
Isolate
It's coming.
yourself for one day. Phone
coming.
off.
Yeah.
It's coming.
You know, and
Yeah.
then and see, because it is our reality.
Yeah.
I probably lose my marbles not having to be able to interact with my kids for 14 days. But
Yeah.
if it does happen, I will have to be. I will have to protect them.
Just go buy another
and-
phone. And
yeah.
a friend of mine did that.
Yeah.
They used to call each other in the house.
In the house, yeah.
And I was sad, but they did it 14 days, he's
Yeah.
fine and everyone's fine. But accept that you're going to get it, find out your conditions.
Be ready, put your gloves on.
Forget about Mhlonyane. Go find out if you're diabetic or not or
So
whatever.
sebenza.
Iyasebenza, masefikile.
Masefikile.
Yes,
Okay.
hi, mega.
Alright guys, listen, I could actually speak to Dimple and Tabolo for like the whole day, but I do need to close.
Yeah.
Thank you so much for tuning in. This has definitely been an insightful discussion for me. It's very different from what I hear on a daily basis. And like I said, you hear it every day and you kind of block it out because it's COVID. But please take time to understand what your health status is and block out the noise, as Dimpo said, and understand how strong you are from an immune system perspective, and be ready for it. It has entrenched itself in our world. It's there, it's happening. You almost can't prevent it. You almost need to welcome it and embrace it, and if it comes, and be able to deal with it. And that's really the issue. Thank you so much for tuning in. If it is the first time tuning in, don't forget to subscribe, like, and comment. Please share your experience with us if you have been infected or affected by the virus. And it's been real. Thank you so much.